Are you treating your biofilm correctly? What is biofilm? Biofilm is a group of microcolonies of bacteria living on a protein matrix made from the water in your mouth. The matrix allows for circulation of nutrients and bacteria byproducts between the bacteria and your mouth. Biofilm occurs both above and below the gum. Let's take a look at what happens below the gum. The gingival sulcus, or pocket, is a truly unique living environment for bacteria. Here, the biofilm cling to the only non-shedding surface, the tooth root, in the body. Every other surface in the body is comprised of shedding cells. Being below the gum and away from normal home care creates an ideal habitat for bacteria to multiply. In fact, a typical mouth contains over 7 billion bacteria comprised of over 500 distinct bacterial species. If you have the gene which predisposes you to periodontal disease, then there are over 28 billion bacteria in your mouth. That's 4 times as many bugs. Once biofilm has been present for 24 to 48 hours, it produces a calcified shell to protect it from the body's defenses and from antibiotics. In other words, the battle wall has been built. In order to win this battle, you must first breach this shell. Biofilm, when combined with risk factors like age, smoking, tobacco, genetics, stress, medications, clenching and/or grinding of the jaw, poor nutrition, and obesity, almost invariably results in gum disease. How is gum disease caused by biofilm bad? Well, the first answer is obvious. It's bad for your oral health. As long as biofilm is present, it causes inflammation. This in turn causes bone loss and eventually results in tooth loss. It's also not pretty, generally causing dark spaces to develop between your teeth. The deeper the spaces get, the harder it is to treat the biofilm, and the likelihood of retaining the affected teeth goes way down. Now for the not so obvious. Biofilm causes inflammation, the body's natural response to insult. Inflammation is also known as the silent killer. In fact, the continued presence of biofilm strains the immune system and in turn contributes to the following life-threatening conditions: autoimmune disorders, arthritis, 6% increase in risk of cancer, diabetes, Alzheimer's disease. Because of the permeable nature of the gums, the biofilm also gets into the bloodstream. It can then cause arterial blockages, leading to a higher incidence of cardiovascular disease and stroke. Dr. Oz said good oral hygiene, translation, control your biofilm, would on average add 6 years to your life. Removing biofilm, how hard could that be? As mentioned earlier, a special feature of biofilm is that it calcifies. Remember the battle wall? This hard shell protects it from both your home care and from antibiotics. Therefore, the calcified biofilm, especially below the gum, must be removed in order to comprehensively treat biofilm. Removing calcified biofilm is like trying to remove barnacles from the bottom of a boat. In other words, it's not easy and it's done in a very challenging environment. Your hygienist must chip and scrape and chip and scrape and then chip and scrape some more. If there's any trace of calculus left on the tooth surface, inflammation will continue, which is why special attention is paid to calculus below the gum line. This is a daunting task. Think of it this way. Biofilm is like a thin coating of peanut butter left in a jar that's been covered in black paper so you cannot see inside. If you were to cut a thin slot in the lid and then take a spoon and try to remove all the peanut butter, you'd have a good idea as to what your hygienist is faced with. Now for an added challenge. If there is microscopic root roughness greater than 1 micrometer or scratches which facilitate adhesion of biofilm, root planing will be required to smooth them out, which reduces biofilm recurrence by 90%. So, while a normal cleaning removes biofilm and calculus from above the gum line where we can see it, it is doing the most damage below the gum line in those hard to reach and hard to see spots. It's important to address these areas as soon as they are discovered to have biofilm and calculus evident. Not doing so makes the process infinitely more challenging and can result in serious oral and whole body consequences. Keys to effectively treating biofilm below the gums. Time. It takes more time to remove root irregularities and barnacles in the dark. Instrumentation. At Rohrer Dental Wellness Center, we use special tips on our state-of-the-art ultrasound device that get to the tough spots and helps to dissolve the calcified shell, while simultaneously releasing biofilm-killing antimicrobials. Training. Dr. Joy Rohrer, DMD, leads Rohrer Dental Wellness Center with her special expertise in this area. She has treated thousands of patients and has also trained hygienists at Palm Beach State College on these exact same protocols. Patient education. A patient needs to understand the root cause of an issue so it can be prevented in the future. Once we put the fire out, true oral health happens at home. Then our role can become one of prevention instead of treatment, and we are here to teach you how to do that. Due to the aggressive nature of biofilm and calculus development, around 75% of patients we see need a deep cleaning, and almost all of them elect to go through this process, resulting in a 98% success rate of reducing oral inflammation, meaning they can generally keep the affected teeth and experiencing improved whole body health.